Good evening. I'm your host, Dr. Johnson, Sonia Johnson. Okay, so waiting for some people to join us. If you want to have your friends to hear this message, just tag them. If you want to share the screen, just press the button at the bottom of the screen. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. So today we're going to move and talk about products. We talked about products last couple of days ago and for the last couple of months. Now we're going to talk about procedures. So procedures that you can do to help your skin get the results you're looking for. Okay, so the first procedure we're going to talk about today is chemical peels. So we've talked about chemical peels before. And in the past, I mentioned how chemical peels are really good to help with exfoliation. So it helps you to obtain that glow that people are looking for. But also we use chemical peels to help with discoloration as well as to help with acne and to help even out the skin tone. And that's how I really use it, to help even out the skin tone. But chemical peels can be your beta-hydroxy acids, which is your salicylic acid, or there's the alpha-hydroxy chemical peels, which is more your glycolic acids. And those are your superficial chemical peels, but also there's a deeper chemical peel called your trichloroacetic acid. So when you're getting your chemical peels performed by a professional, you want to make sure it's good for your skin type. For instance, anyone can use the alpha hydroxy or beta hydroxy, but the trichloroacetic acid is normally for people who are lighter skin tones or skin types 1 through 4. 5, you're pushing it, but you want to ease into that so you won't get discoloration or have a burn that leads to more discoloration. But as far as chemical peels are concerned, when you get it performed, you clean a face and they put this acid on your face. It's an acid that's diluted out, and they leave it on for so long. And each one has a certain amount of time. For instance, your glycolic acid, we can leave one for 3 minutes and that's safe. And after 3 minutes, you rinse it off and water neutralizes it. However, with other chemical peels, there's other products they use to neutralize the chemical peel. And if you still feel burning, you want to let the person know, because as the chemical is on your face, it produces a tingling sensation because it's working through and breaking up the cell, the bond between each cell, the cells on your skin. However, if it's too strong or it stays on too long, it would cause irritation and burning. So again, you want to see a professional and make sure it's timed and let them know. If you have an area that's a little more sensitive that you can't tolerate, let them know that. And next time you have it done, you'll be able to tolerate it better. But regardless, you keep rinsing the solution off until you feel nothing, until there's no more tingling or burning sensation. Because if there is and no one knows that, when you get home, the product is still active and it can cause more damage. So again, when we perform chemical peels in the office, we rinse it off, keep rinsing, and once we're done, we ask the client, do you still feel anything? If they say no, we rinse a couple more times to be on the safe side. So if you're using products such as your exfoliators, such as Retin-A or retinoids, you want to make sure you stop those prior to your chemical peel. And I tell people to stop it like 3 days before. And even after you have your chemical peel performed, you don't resume those products until a couple of days after, okay? So just keep that in mind. Any type of products that exfoliate the skin or even abrasive procedures you can do, like sugar scrubs, or have a sponge that's a little more abrasive on it. You don't want to do any of that if you're going to have a chemical peel performed. And again, you want to make sure who's ever performing this, which is usually a trained esthetician or someone in a medical office such as a plastic surgeon or a dermatologist office, whoever they have trained to do these procedures, you want to let the person know, hey, I use these products, and you want to let them know when the last time you used the products so they can advise you on what's best if you're going to have a chemical peel performed and it may have some type of interaction, okay? Otherwise, once you're done, when you get home, when they're finished rinsing your face and pat it dry, they tend to put some type of moisturizer on and or a sunscreen. But once you get home, you're going to notice microscopically exfoliation. And that can last anywhere from a day to up to 4 or 5 days. And on average, 3 days. But regardless, some people have more exfoliation than others. And exfoliation is really just saying peeling of the skin. So you can see it microscopically, in which you'll notice just dryness of your skin, or more profound, in which you're peeling off sheets, layers of skin. As long as you're not left with the rawness underneath, that is still considered normal, and that's okay. Some people don't like that, and other people look for that. So everyone is different, but that does not mean that you had a bad outcome in no way whatsoever. What you need to worry about is as long as you're not irritated. So if you notice some irritation or sensitivity of your skin, again, rinse it yourself, and then put a moisturizing ointment on, something like a Vaseline base, so it won't irritate you, because your creams and lotions tend to have some type of alcohol-based preservative in it, so it'll stay on the shelf longer. So you do not want to put that on open skin or irritated skin. You want to use a Vaseline-based product, and let the professional know ASAP that you're having some type of irritation, so they can advise you on what they recommend you do. If there's no one and you're doing it yourself at home, I recommend, there's some things over the counter you can try, like your hydrocortisones, and mix it with some Vaseline, and that'll help ease the sensitivity. But then I will again follow up with the doctor at that point to make sure you don't have any adverse outcomes. So chemical peels are good things to do, but you want to be safe about it and very smart about it. We start people off really mild with a mild chemical peel and work our way up to a strong one, because number one, your body actually tolerate that better than going from let's say a 10% glycolic acid to a 70%. But every time you come in, we work our way up slowly, step ladder progression from 10 to 20 and so forth, you can tolerate it without any bad side outcomes or side effects. So again, chemical peels are really good anti-aging. So we recommend, if you're doing it for that reason, once a month. If you're doing it for acne and discoloration, I recommend it every 2 weeks. Again, you can do it once a month, but you get a lot more, a better outcome and faster resolution and outcome if you do it every 2 weeks. For acne, it actually controls the acne eruptions that you don't even break out that much. If you have oiliness, it does a wonderful job for that, as well as help with the white and blackheads. But for discoloration, I really like it for that reason, because like I stated, it gets the skin really even. So if you're using bleaching creams on the dark spots, when you have acne bumps, you do pick at them. A lot of people do, though they say they don't. But in some cases, you don't have to. It leaves the dark spots behind. If you start using a bleaching cream on that and you're really meticulous about it and only on the dark spots, you still end up with a ring around it, or the bleaching cream lightens the area really blotchy. Well, this is why I like chemical peels, because it actually, when you put it on all over, it evens out the skin tone. And besides controlling acne, helping with anti-aging, it actually evens out your skin tone and gives you that natural glow. So chemical peels are really nice to do. It is acid, but it's diluted. And so they're safe as long as you know what you're doing, or you go to a professional, okay? Any questions for me? Okay, well, I want to thank everyone for joining me. I do appreciate it. And if you have any questions, put it in the comments section, please. And so definitely I will answer them, and may make a live stream session about it to educate everyone else. Again, thank you again for joining me. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. If you want to have a private virtual dermatology visit in which I get to help you with any concerns you have with your skin, hair, or nails on a one-on-one basis at any place of your choosing, go to I-want-clear-skin.com. And you will receive a free gift, as well as a way to schedule to see me. You take care. Have a wonderful evening. Take care.